Dr. Tony O'Sullivan is co-chair of Keep Our NHS Public and a retired consultant paediatrician. Doctor, very good afternoon to you.
Good afternoon. Hi.
Tony, welcome to the programme. Look, as a consultant, you will have worked with junior doctors. How important is it for the NHS that they're kept motivated, and how big a part do they have to play in our NHS?
Well, indeed, I've been a junior doctor, and they play an absolutely vital part. The name junior is a misnomer, really. That they're completing their specialist training, but they're qualified doctors. They have anything from straight out of their probation year to several years of experience, and the NHS relies on them for face-to-face patient contact and assessment and treatment, operations, GP work, right through the system. So they're an absolutely essential part of the NHS workforce, along with all the other team members.
Doctor, 11 strikes in total, if I'm not mistaken. The impact of these strikes, I think, would I be right in saying it's been felt by many?
Oh, undoubtedly, it's the impact has been significant, and it's not just on patients either. It's on the mental health of doctors and the mental health of and the well-being of the NHS itself. I think the junior doctors have been clear that safe patient care requires a motivated workforce, doctors, nurses, right across the board, who aren't exhausted and whose morale means that they will stay with the NHS, that they won't be looking for a way out, they will be motivated to put the patient first. And that is what's been severely damaged over the last few years, very, very dangerously damaged by this government, not just the previous government, I should say, and not just doctors, of course, but right across the board in health and care. And they've left a very dangerous situation. As you've just referred to, we're talking to Keir Starmer, 7.5 million people on waiting lists. Tens of thousands of people avoidably dying. I'm not sure if you've come across that figure, but 39,000 people died on cardiac waiting lists in 2022 alone. Yes, junior doctors are essential for the survival and the running of the health service, along with many other staff. And yes, I welcome that there may be a breakthrough now, that this government, in just a few days of engaged talks, seems to have taken the BMA case seriously and made an improved offer.
Well, will there be a breakthrough? Because 35% is what junior doctors have been arguing for. The government has done a deal with the BMA at around 22% for over 2 years. But, of course, it's got to be approved by the members. Do you think they will accept or reject that deal?
Well, I wouldn't second-guess that myself. I know that 35% is the figure. That's the total deficit of pay value from 2008 to the current day. And I'm not sure even if that's been updated with the quite severe inflation that we've been through for the last 2 years, where inflation was about 11% on top of that. So when we talk about a 22% pay deal for 2023-4 and 24-5, please don't forget that 11% inflation has already eaten away at the value of that. But it is an improved offer. It's potentially a statement of goodwill and respect for the junior doctor's case. I suspect that if the BMA has been doing its job, they will have raised the question of pay restoration over a period of time. I don't know whether the government's committed to that. And I don't even know whether this pay deal is extra money or whether it's going to come out of another part of the essential set of funding for the health service. But I hope for the future. I hope positively for the future.
Well, I was going to ask you, Tony, I mean, the pay deal is on the table. Let's see if the members accept it. But will this deal be enough to stop junior doctors leaving the profession? Because we do have a problem here.
Well, I don't think they are paid enough. It's particularly vicious when they very early start off. They're starting with student debts, of course, of £100,000. In many cases, there are all sorts of issues, including cost of living, childcare, that every other member of the NHS has to face. I mean, I'm not sure whether this won't be the end of the story. I suspect that they will be arguing that this if they accept it, this will be the beginning, and they hope for good faith from the government for supporting NHS to improve morale, to improve retention of staff, and to improve recruitment of staff, rather than the situation now where 4 in 10 doctors, soon after qualifying, are planning already their exit from the NHS, and the same for nurses. And that is a situation we absolutely cannot afford.
Tony, I asked the last question because at one hospital in London, I'm aware of some junior doctors refusing to work night shifts as they say that will affect their mental health, which is why I asked you if pay will be enough to stop junior doctors leaving the profession, because it seems there's a big, it's not just about money, there's lots of other things associated with the pay deal that it seems junior doctors would like to have resolved.
Yes, of course. I mean, being on call at night is an essential part of the safe running of the health service. So I don't know anything about individual doctors saying they can't do it. And there may be individual circumstances that would require negotiation between themselves, the BMA and the health service for that, if that were about their own safety or well-being. But it's true that doctors work long shifts, as do other sections of the health service, but there is no place where they can sit down and rest, have any peace. There's no hot meals provided during the night. There's charges for car parking without regard to staff safety, arriving late at night and going home early in the morning. There's all sorts of issues about terms and conditions and respect for the staff and the job they're doing for the health service that would be part of ongoing negotiations, not just for doctors, but for nurses, therapists, radiographers, etc., across the board. And yes, that's an important point to be asking, Rob, but I don't know what detail will come out in the negotiations so
Tony,
far.
And I really appreciate your time this afternoon. Can I ask you, Tony, you're a doctor, co-chair of Keep Our NHS Public and a retired consultant paediatrician. And this is not quantifiable, but do you think there might be some goodwill from people who work in the NHS right across the board towards a new government? Again, it's not political, but do you think there is more goodwill to this administration than the last?
I think there is willingness to look at what they're saying and see what they deliver. I think there will be a very short holiday period or honeymoon period where that goodwill would be maintained or would evaporate depending on what's happening. In the Labour Party manifesto, there are many things that are potentially positive, like 8,500 new mental health staff, resurrecting the centrality of a family doctor and the ability of a patient to see the family doctor of their choice with continuity, the restoration of NHS dentistry, the reduction in waiting lists. But all of those things require significant amount of money. They require goodwill from the government that they actually want to restore an NHS that is public. If NHS staff see the government throwing money at the private sector on the pretense of attacking waiting lists, when if they put that money into the health service would be the place to address waiting list problems. If they don't see an ongoing restoration of pay and respect for public service for NHS staff, and if they don't see funding going into repairing broken buildings, repairing dangerous ceilings falling down, and improved CT scanners, MRI scanners, and IT support, if none of these things materialise, then the honeymoon period will be relatively short.
The next few days could be key. Tony, thank you. Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public and a retired consultant paediatrician.